me all right? So our wonderful patient, celebrity patient, is Nicolette, and she's never had any neuromodulator. Straight, raise your eyebrows, okay? So she really would like to lessen those forehead lines. Oh, well, the third thing that she mentioned, and that's the smile lines here. So when she smiles, it would relax. So you see that when she's not smiling, she's begun to etch those lines into the skin. And they're not that deep, but they'll continue to get deeper as she gets older, just from smiling. So I like either Botox or Dysport. We're going to use some Dysport. I like the way Dysport spreads. It seems to cover a larger area than Botox does in a forehead. So my approach for her with Dysport would be to use what would be the equivalent to about 10 units of Botox. Raise your eyebrows, so it'll be close to about 20 to 25, between 20 and 30 units of Dysport in her forehead. And if you watch how she raises her eyebrows, okay, she doesn't peak quite so much, just a tiny bit there and there. When people peak a lot here, they end up with that kind of a look when you have, just the middle part of the forehead. So I'm going to go out to about there, and then frown. Squeeze your eyebrows together. So do you see that she doesn't bring her eyebrows medially at all? She is a depressor. She depresses her eyebrows. Go ahead and frown. So what she does is she depresses the eyebrows without even bringing them forward. So I like to put Botox or Dysport right there and right there. And then a little bit maybe in the procerus, but and then crinkle your nose. She doesn't like that either. And so I'll put a little bit in the nasalis of Dysport on both sides. And then outline her lips, add a little volume. If you look closely at her lips, the right lower lip is fuller than her left lower lip. That's just naturally how she is. And she was not aware of that, but when she looked in the mirror, she realized that her left lower lip was not as full. So we'll outline her lips, and then I'll use a little Juvederm and a little Juvederm for the smile lines there. So rest your head back here, like that. And if the camera, so I'll start with the Dysport. And then I think in foreheads, especially for a first time, less is better. Now I'm not going to have a chance to get to see her back. So the one possibility is that the eyebrows might get elevated too much when you're putting the neuromodulator in this area right here. In her case, I don't think she's going to elevate the peak of her eyebrow too much by putting about 25 units of Dysport. So, you ready? Mm-hmm. Okay, so she's never done this before. So raise your eyebrows. Okay. And then relax. So I'm going to go right mid this area here. This reconstitution is reconstituted at, the Dysport's been reconstituted so that there's 10 units per 0.1. Raise your eyebrows again and relax. Okay, great. So I'll go right there. And that's about 5 units. Raise your eyebrows again. Relax. And then out here I'm going to use a little bit less. This is about 3 units, which is, so that is 13, and then turn a little bit this way. The camera can still see. Tilt your chin down or head down, just perfect. Okay, and then raise your eyebrows and relax. So 5 there. Turn here. And then I'm going to judge about, this is just lateral to mid-pupillary line. Raise again and relax. And then I'm going to go with about 3 right there. That leaves me with about 30 units left. And then I like to do this area right here. I even do that when I'm doing the corrugators. So squint, or I'm not squint, but frown for me, if you can kind of frown. So bring your eyebrows together as much as you can, okay? And relax. Let's see if I can do this without you being able to see. So I'll put, if I'm using Botox, I use about 1.5 units right here. And with Dysport, it'll be about 4 to 5 units. What that will do is will raise the medial eyebrow. So even though you're putting a neuromodulator here, the medial eyebrow is going to come up like that. Okay, and then I'll have you turn a little bit here, and then frown again, and relax. And I'll go right there, about 4 to 5 units of Dysport. And that leaves me with just under 20, so I'll put about 10 and 10. about the equivalent of about 3.5 units of Botox per side in her nasalis. So crunch your nose for me. Okay, and then relax. Crunch your nose again. Okay, so she has not much, even of, there's a little Proceras function, reaction there, and I probably put a little bit in that area. We'll go right there. Ready? It's 10. And crunch your nose again and relax. And 10 right there. All right. Okay, perfect. Okay, you did great. So, and then I have patients with Dysport and Botox animate these muscles for about an hour afterwards. Every time they think of it, I have them raise their eyebrows up and down and frown, and then I have them avoid rubbing it for 4 hours. That's pretty much the only limitations, that not to rub this area. And then I'll go to the Juvederm. How was that? Not too bad? Okay. So, and let's give you this cold pack here. Teresa, do you want to break that if you don't mind? So again, I like to start by, I gave you a tear, sorry. I like to start by outlining her lips. So, Nicolette, if you hold that kind of on your lower lip, and then I bend the needle about 45 degrees with the bevel up, that, and you can take that away. And remember, her left lower lip pillow is smaller, sorry dear, than the right side. So this is just right along the vermilion border. Okay, you're doing great. I know this is a sensitive area and you're doing great. All right? Okay, and then if you turn here, I usually go to the other side, but I'll do it from this side here. And again, this is going to end up being probably a total of about 0.1 ml of Juvederm. You can turn a tiny bit there. Almost done with this part. And I like to outline the lip first. You had a piercing, didn't you? I don't know how that compares to this. There, you did great. Okay. And then I'm going to, so put the ice on your upper lip, and I'll put a new 30 gauge on, just because his lip, it's more comfortable when the needle is sharp. So I'll sometimes go through 3 or 4 30 gauge needles when I'm doing a syringe. This is for the tear I gave you in your, you're doing great. Okay, and you can take that away. All right, and so if you bear with me, this part. Okay, so I start at the Cupid's bow. I'll put a little bit. Okay, there you go. Okay, and a little bit right here. Okay, and then is that once I get done with this, it'll be easier. There, okay? I'm injecting retrograde for this part, all right? And then put the cold right on the right upper lip to come to the other side here. Okay, and if you take that away there, now to turn here. So I'm angling just along the direction of the Cupid's bow there to create or accentuate the Cupid's bow. Okay, and then last right there. And that was a total of 0.15 for upper and lower vermilion. And then I'm going to start on the side that could use a little more volume. Her left lower lip. And if you put the cold pack there again for a moment, I could exercise this way here. So, okay, and then you can take that away. All right, so this would be easier here. Open. Okay, Okay, so a little bit right here. I also go right really at the junction between the wet and dry lip. Go in, and then I just find there's less likelihood of bruising if you inject both antegrade and retrograde. That was 0.1 for that pillar. When I was showing her in a mirror, she was looking in the mirror, and all I did was made the left lower lip look fuller. To her, it already looked better. Okay, and then I'm going to put a little bit more there. Okay, you're probably getting a little numb there. Okay. And then why don't you put the ice right on the right side there?
Sorry?
Uh-huh. So we're almost done with this part. Not too bad?
Mm-mm.
Giving you a few tears there.
Oh, the lights are so bright.
Well, you're a celebrity. You have to get used to being under the lights. Okay, take that away. Okay, we're almost done with your lower lip here. And I do it in this looking down as well, because I can really just see the way the volume of the lip is looking. So her right lower lip doesn't need as much as the left. Okay, so we've used a total of 0.3. So that's about 0.15 for the volume in her lower lip. Okay, and then we'll go right here. And this is right at the junction between the wet and dry lip. I'll go right there. I'm injecting very slightly in the, but I'm injecting as I move in an antegrade fashion. And now I'm injecting as I draw back. That was 0.1, so we're almost done. Okay, and if you open here, I always shape this part right there. And shape the lower lip. So when I just use a thin gauze, because the lip otherwise sometimes is slippery for the fingers, and that way I can feel where that filler and product is. But Nicolette, if you put the cold pack right on your right upper lip there. So she'll have about half a cc of Juvederm. And just by experience, that volume in an upper and lower lip, usually, I mean, it's certainly enough to that patient see a difference in how their lips look, but after a day or two, it's usually not obvious to the rest of the world that she's had filler put in her lips. But she'll see a difference, and her lips to her will look fuller. Okay? And then if you turn a little bit towards me, open just a little bit. There, okay? Bring your lips together. Tilt your head down a little bit. Okay, and then you're doing great. The last is the smile lines. So these etched lines, this is, even though it's in the nasolabial fold, and actually I'm going to have you sit up a little bit more. I can set one more pillow and then rest your head back like that, okay? So these, it's not really filling the nasolabial fold. I'm actually just going to do the smile line right here. And I like to bend the Juvederm. I like Juvederm for this. I like to bend the needle, and then I'll just go right just underneath the skin. And with a bent needle, it's so easy to just follow that. Draw it back, open here. So I explained to her already that when she smiles, she's still going to make those lines. This won't change the way her lip, her smile is. But by putting a little bit of filler in lines like this, or the lines that Dr. Maz showed in one of the patients, the upper lip lines that he filled in with filler, it not only lessens the lines visibly, but when you have a little bit of filler in there, all the animations that accentuate those lines don't accentuate the lines as much. And so even though the filler may begin to diminish after several months to a year, the lines don't seem to come back as much. Open here. I've had patients go 3 years without having their upper lip lines done again after filler. You did great. Let me go to the other side. So we'll be done in just a moment here. Any questions at all? Okay, so you can go ahead and sit up. Okay, go ahead and sit up here. Open your mouth. So I like to smooth out filler in a line like this, or in a nasolabial fold with a finger inside her mouth, and then just to smooth the filler, you can do it on both sides, right? We'll clean you up a little bit, but you did great. So.